the most common misconception that clinicians have about pediatric metabolic and bariatric surgery is that it is a last resort, that we need to wait until patients are living with severe obesity and multiple obesity-related complications. And this is a chronic disease that requires chronic long-term care, just like any other complex chronic disease in pediatrics. Lifestyle alone is only going to result in a 5-pound weight loss over a year for the average young person, which is not enough to reduce risk over time. Medications are excellent, but the average medication, like an injectable agent, results in about a 30-pound weight loss over a year. If your young person needs to lose 100 pounds to decrease their risk of these life-limiting complications, then that's not going to be enough. What physicians need to understand is that the disease burden of obesity is far greater than any risk that this treatment could possibly give.
The sleeve gastrectomy is the most common bariatric surgery in the United States. The weight loss associated is about 60-65% of excess weight, and it has an extremely low risk profile, is exceedingly lower than gallbladder surgery. The recovery is fairly easy. So our patients stay overnight, same day as surgery, are up and walking. Usually within 2 weeks, they're back to school and then back to a regular diet around 1 month after surgery. So that's how safe and effective it's become. 80% of people that go on to have bariatric surgery will say, had someone talked to me about this sooner, I would have done it sooner. I wish someone had told me this was an option.
I wasn't worried about my daughter having the surgery because I'm a bariatric patient myself. I know how life-changing it was for me. It was very important and exciting when I heard that there's an opportunity for her to do it at the Children's Hospital Los Angeles.
Here at Children's Hospital Los Angeles, we have a interdisciplinary pediatric metabolic and bariatric surgery program. So we have pediatric endocrinologists, we have psychologists, dietitians, and bariatric surgeons doing this work in a family-based shared decision-making model, coming together to make sure that the patient and their families are understanding what it means to have bariatric surgery and have all of the tools that they need to really optimize this care over time, both before and after the surgery. They meet with our surgeon and nutritionist and really decide whether the surgical pathway is appropriate for them. That process can take as little as 3 to 4 months from the time of first consult to the surgery date. If the patient needs to go at a slower cadence, we will honor whatever time they need before they feel ready for the surgery. As of September of 2025, we have done 110 surgeries. And in August of 2025, Children's Hospital Los Angeles became one of 8 programs that is accredited by the MBSA QIP. And this was something that we set out to do to ensure that we were meeting the excellence qualifications that exist within the American College of Surgeons. We are slotted to be one of the largest programs based on the volume and number of surgeries. So I think there is a huge role for clinicians to really understand their own bias, their own fears, ask questions, and really learn about how this might be the best choice for their patient. They are the first point of contact getting the patient into the program, but they actually are the greatest cheerleader to keep patients in the programs.
We're happy to partner with referring docs. We're happy to see their patients. We're happy to partner with them and give them the tools and resources to help that population of patients.